Good evening, and welcome to the Social Services Committee. Our joint committee is completed, and we are now going into our Social Services Committee. We have some some presentations that will be given by staff this evening. First, we'll have a order of the roll call before we go into the declaration of the quorum, so that we will allow, we still have no one virtually? Okay. So that we can be about the business of getting into our social services items and on this meeting day. If I could please have a roll call.
Chair Hayes,
Present.
Vice Chair Nagola,
Here.
Renee Phillips,
Present.
Mercedes Fernandez, Councilmember Harris,
Present.
Samantha Oldsfry.
Present.
Thank you. Ken Rowling.
Present.
Thank you.
And with that, we have a quorum, and we are able, with no participation at this time, virtually, to go on to the approval of minutes that are in the packet. Does everyone have the packet for the Social Services Committee? We're about to review, and if there are changes or suggestions regarding the minutes from May 8th, please.
We do
begin.
have them. I
Oh,
do, for the
yes.
first time ever. I was present.
Ah,
However, in the table, I am marked absent,
oh,
which also I think, so I was here.
Yep.
That is all. And I was listed on the list. It's just the table.
okay.
But I was here. At the vote,
At
on the vote. But I voted, and I voted aye.
Okay.
Thank you. I apologize. I will submit corrected minutes for the next meeting. Yes, indeed.
Are there any other corrections or notifications for the minutes at this time? So we will move on for approval.
You could approve as
Move with,
corrected.
yeah, I'll do a motion to approve as corrected.
Second. Thank you. All in favor?
Aye.
Aye.
No, with all being in favor, there are no objections or abstentions, so the minutes have passed barring the correction that will be made. Now we are going to move on to the business at hand. I believe that the staff is going to give a summary and a presentation regarding, my voice is really going. That airplane did me no good. Revised case management and safety net applications and review.
Yes, thank you so much. Okay, so at the last meeting, we did review the evaluation sheets. I will start with those. Based on the input that I received from the committee, staff has made the following changes. We did include a scoring component that we're going to ask the committee to potentially approve tonight. Staff suggests that of the three options, that we weight them the highest one for 10 points, the second for 5, and the third option, which I will review momentarily, for 0 points. We believe that this spread will really help differentiate between the applications. So the case management evaluation sheet would be worth 170 points all total. The safety net would be worth 160. The reason the safety net is a little bit lower is because we're not assigning points to the safety net services category, which I'll also review, but we talked about short-term poverty interruption, long-range poverty prevention, basic needs, and enrichment. We don't want to assign a value to those. The sheets also include an administrative review section. The administrative review section would not be weighted. It would just be like a meets or does not meet. and it would allow staff to give the committee an idea of whether or not applicants would be able to handle the administrative burden of reporting on their program, whether staff had concerns, and staff would discuss those with the committee or bring them up with the committee, or whether the applicants potentially were not eligible. Any ineligible applicant would still be presented to the committee. We would explain why they were ineligible based on our scoring. Any questions? Okay, great. Then let me open up the evaluation sheets. This went much better last time. Yeah, no, we can't read this. I apologize. Okay. Well, the evaluation sheets haven't really changed, but I can scroll down to highlight some differences. Based on the feedback of the committee, staff added one section here under case management to really drill down to what we heard from the committee members about whether or not the programs in prior years had tangible outcomes for the participants they were working with. And then again, our three sections were requirement not sufficiently met, which would be worth 0 points, requirement partially met and or partially documented, and staff would assign that 5 points, or requirement fully met and well tracked. And then we did not review this last month, but here's just an overview of the administrative review section, which is available online and is available online in the packet. But again, these are like yes, no, met, does not meet, or does not meet the requirement. And for the most part, this administrative section is just that. Did they submit the required documentation with their application? Do they have robust tracking systems? I would be happy to review any of these indicators in depth if people had thoughts or concerns. This is completely up for review.
Questions or comments? I know we had a pretty extensive conversation regarding the pull downs in this section last time. Thank you for this. For those who have the printed out, you can't see that it is a pull down and has, if you could just pull down one of them. A drop, yeah, a drop. Mm-hmm. And stuff. So it's a little hard to see, but it's, they're able to, the point was to make it easier for us to evaluate what those grants, if those grants were making, or if those requests, I'm sorry, were making what we thought was the grade, for lack of a better term, of what we thought was interested, of meeting their need, meeting our needs to evaluate their application. So those
I
are-
apologize, I was on the wrong drop down. But yeah, this is the drop down that
Oh,
SSC members would see. Yeah.
yeah. Just as a refresher to everyone.
So if I can add one thing, I think part of the discussion last month was that by including those drop downs, the committee has a even review and an agreement in advance of what points mean. And so tonight, we're hoping to also discuss the assignment of the points, which the suggestion by staff is fully met and well-tracked and documented is 10 points. The middle section, which is partially met and or partially documented, is 5 points, and not sufficiently met is 0 points. So we're all in agreement, and there's enough of a, as you were saying before, enough of a spread to make the data kind of,
Alive, yeah.
yeah.
Are we all on the same page so far?
So then I'll move to the safety net rubric or evaluation sheet. Again, the determinations are the same in terms of requirement not sufficiently met, partially met, or well-tracked and documented. Staff is proposing the same point spread for all of them. Sorry, that went a little quickly. Okay, to drill down to ideally quantifiable outcomes from prior years, staff did include this question. Program provides measurable services, and they either, again, demonstrated that in the application. This criteria does link to a specific question on the application questions that was highlighted. And then this is the identify the category of safety needs service, which is in yellow. It will not have a point system assigned to it. And our categories are basic needs, direct poverty reduction, crisis prevention or interruption, long-range poverty prevention, or enrichment and engagement. So I have to confess, SSC members, there was a little bit, after reviewing our meeting, I think there was some appetite from members to combine long-range poverty prevention and enrichment programs, but I couldn't quite suss that out in our meetings. So another thing that we would like to propose is, do we keep it the 4 categories or 3? Are we not minding? Okay, it might also help in evaluating the applicants once they come in, because then we could see.
I agree. I'm good with it as it is. Do we have any comments or suggestions for adding or reducing the 4 categories? One more
Sure.
time.
Yeah, the 4 categories for safety net services are, they either provide for a basic need or there's a direct poverty reduction component to the program. The program addresses crisis prevention or crisis interruption, long-range poverty prevention, or engagement enrichment services.
You're good? Okay. That's all right. Y'all can talk to me. What?
I guess I was struggling with the long range. If any one of them.
Yeah.
Can you turn on your microphone? This is what happened, I'm sorry, this is what happened at the last meeting. There was discussion without microphones and then I couldn't hear.
I forgot it was here. No, I was saying, I was just struggling with the long range. I think it said long range reduction, poverty reduction. But the other 3 is part of everyday talk, you know. Well, I guess I was struggling with the long range poverty.
I think we spoke about this last time, like that the long range could potentially be something like education for like,
Budgeting skills.
yeah, and so the next year, you don't necessarily see an economic impact, but that doesn't mean that investing in kindergartners doesn't make sense because there's a long-term
Right.
economic impact. So I think that's what and now that I'm saying it, I think that recalling, one could potentially call that enrichment depending on where it falls, and that might have been where there's some gray. My instinct is we keep it at 4, and then if everything comes in and it looks really gray, because they're selecting their own category, right?
No,
No, we are?
yes.
Oh, that'll be fun.
So long range in essence means over a year impact.
Although, yeah, that is an excellent suggestion.
I would
perhaps.
love it if they could select their category.
No, sorry.
But during public comment, we'll hear. Nope, we do care, but I do think that, like, you know, it's gray enough that I could call it something, somebody else call it something else, and it looks really funny. It would be easier if they defined
What we,
it themselves.
what we can do is we can add it as a question, which I think you just wrote down, and then you can review that as a committee and decide whether you agree with that or not.
That works great.
So we can make sure there's consistency in who is applying what.
It'll be interesting to see the responses to that part, that piece of it.
Absolutely.
And then, I mean, you could also gauge it from that, long-term, down the road. But I do see, and the only reason I mentioned it, I'm struggling with it because as an agency person, I wouldn't know how to address that piece of it. Like, where would I start on a case-by-case basis? Because it's going to be case by case depending on how affected that the one household is versus the other one. Does that make sense, the way I'm saying it?
It does, and I would appreciate, as staff, I would appreciate additional conversation around that so I can provide this direction to the agencies as I'm thinking about it.
I was just trying to think of it from an agency lens. But all in all, it still looks great. I was just struggling with that one little piece, and I had to say something.
Should we define what long range means as a time limit? Or
So, yeah, I think we talked about time limit last time, and what we meant with long range wasn't necessarily, I mean, there's a time component, but it was more of a kind of an investment where you don't, and I think you put it very well. It's like a scholarship for a teen to be able to go to college has an economic, like a poverty reduction component, but it's not something we can necessarily quantify, or it's not at the same level as a program that is providing, I don't know, rent assistance or workforce or childcare for somebody to be able to go get a job right this minute and provide for their family. So I think that's where we were making the distinction, rather than, oh, this is happening in 6 months versus 24 months. I think the example of like the kindergartner, like, because when we were discussing like, where does an education program fall? It can be a poverty reduction program, but it's more in concept and in the much longer term. And when we heard feedback from the committee around poverty reduction, it seemed to be very much now. How are we helping people now? So that was the distinction we were making. There is a potential for moving this up into poverty reduction to kind of reduce the confusion. If you decide to keep 4, that's something that could be moved later on, if you wish to. I don't know. if
That's what
maybe-
I was thinking, maybe later on, because at least you have something to gauge a better decision based on the responses of the agencies. Will help us, seeing what they say
Yeah.
and how they answer or address that particular piece of it.
from 0 to 3.
Yeah, and then it's like, oh, well,
And
this agency said that, this agency responded that way, and then we can make our own decision to mesh them into 3 or leave the 4.
And that it's not scored. I think it's just to give us a sense
Yeah,
of
of
sort of like,
course.
it's not,
Yeah.
it's going to be imperfect. We'll probably refine it after we learn more.
Right.
And my instinct on long-range poverty reduction is like you don't see it within 12 months, right? It's like something longer than 12 months where you sort of
Absolutely
see that.
longer, yeah.
And maybe that might help give the agencies a sense of a firmer definition, something a little less
Yeah.
squishy.
And then that'll give the agencies, it'll force them to give better answers about post to after programming, which that's where that comes in at, the long term.
Yeah.
What did you send the clients or households away with
Yeah,
as far as not repeating instability?
I like that.
So that's where we're at.
If I could also add, under like engagement and enrichment, there have been times when enrichment programs haven't applied, like Girl Scouts or Cub Scouts. They're wonderful programs. They do wonderful things. But it might be that they provide experiences that are enriching as opposed to training or more robust safety net.
I wish you could say what you just said to every agency out there and case manager, because we forget about those little programs. That's definitely enrichment for the children, exposure to different things. Yeah.
And very important. Very important.
Okay. Was that helpful for staff and the rest of us? Cool.
So would the committee have an appetite for weighing any of the questions, either under case management or safety net, to give those responses a little,
Tweak.
yep. Or are those responses that are more important to, are there any responses that are, yeah?
I think I'm not understanding the question.
Do we want to rank any of, like, those criteria, give them more weight than others, or keep them all
Or
equally
keep them-
weighted?
Yeah, so right now, with the exception of that category question, each question is worth 10 points. But it could be that services to reach and support Evanston residents from marginalized and underserved communities, if that's more important to the committee, maybe they want that question to be worth 20 points or 30 points. Yeah. Or measurable services, right? I'm not trying to call out anyone.
I think I might be in favor of keeping them all the same. I think we have a lot of criteria, which is nice, which will help kind of delineate. I think it'd be challenging to weight them. I think they're all important, so I think I'm in favor of keeping them the same, but I'm open to hearing other ideas too.
That,
Yeah. I think the weight should always go by greatest need, based on what we've seen statistically, maybe. But I do agree with that too. But there's whatever the most common problem is, or I hate to use the word problem, but common challenge. Maybe that should be rated higher.
Okay. So
What do you
we-
guys think?
I was originally thinking, along with Amanda, that just keeping the questions worth the same points this year. In part, I think if we potentially rank some with a higher rating without sort of the full appreciation of how this new application is going to flow through, we could have unintended consequences. And I think we should review this again next year after we get the scores while it's, fresh, and say, oh, that kind of, maybe we should have emphasized this, or maybe being equal is the same. But I worry about selecting a few questions to be worth double points or 1.5 points, without a full appreciation of how is all this scoring going to come through and how is that going to feel to the committee. So that's my one, because I don't know what I'd pick.
Yeah, I agree with that. But to answer her question, I was just simply you know, giving my 2 cents and answering her question, and with no disrespect for the process being made as being part of it, the process. I was just saying, like,
Oh, yeah, I didn't.
the biggest need, maybe that would be, you know, had the most weight, but I do agree with that too. Leaving it alone is fine too. If it ain't broke, don't fix it, you know. It ain't broke yet.
not broke yet.
It
We're
ain't even out
testing it,
there.
right?
So that's why I was saying.
I know, Ken, you had something?
Equal to both.
My concern would be if we're putting more weight on one question or other, we need to communicate that to applicants, you know. People need to know if we think something is more important than the other. And to me, there are so many questions here, so many things they need to respond to, that what we're asking any applicant for these funds to give us sort of these questions put together a picture of who and what they're doing, who they are, what they're doing, what they project as their outcomes, and I just, I think if we tell people, we have to tell people that we think some category is more important than the other, you know, to be fair, that's,
Well, I mean, why would they like necessarily need to know that? Like to tell them, what do you mean? Like to tell them like one area is greater than the other? Like we hold more weight in our decision making?
I think we're just talking about the specific questions, not the like category, but just
Okay.
the questions themselves. Like service support or service to support low moderate income Evanston residents. Is that worth the same as the program has a system for receiving participant feedback and incorporates feedback from lived communities? Like, I don't know how to rank one of those more than the other at the moment.
Mercedes or Alderman Harris?
Well, Jessica, stop asking questions.
No, don't stop asking questions.
No, and I
Because-
think they're good questions. I'm still finding my way through the committee. You all have been working on this. So I'm listening, and as an outsider, hope to be able to provide something like, well, what does that mean? Or why are we asking those questions? I'm not quite there yet, but that's what I hope to add to the process, because you all have been working on this. This is my second meeting.
And you're doing fabulous.
Oh,
Mercedes?
yeah, I just want to make a comment that I agree with these questions, but I also agree with asking for more data or to quantify the achievements of these agencies. I think that would be very practical in order to get a more clear idea of what they do if they put it in numbers.
And I have to add that we will also have the opportunity to meet with each agency as they give us a presentation of what they have provided in writing to us, to ask specific questions. I mean, sometimes we ask about language barriers, sometimes we ask about long-term impact, sometimes we ask about staffing efficiency and training. So there is the opportunity when we have the agencies before us to dive a little deeper into their profile. Just saying. Nope. Nope. All right.
Oh, okay. Sorry about that. Would it be helpful to move from the evaluation sheets to the application questions and the changes?
Please. I'm on the wrong page. Okey dokey.
All right. So from the bottom? Okay, thank goodness. Okay, staff didn't make many substantive changes to the questions that we're proposing for the applications. The changes that are highlighted in blue in the list of questions in the packet were more meant to encourage applicants to quantify their responses. And I'm happy to take any questions. Can everybody see the highlights?
Yeah.
Okay.
In the printed out version, it's light gray.
Right.
I didn't
because of
spring for the color.
Economical
Page
decisions.
11. Right.
To Mercedes' point earlier, I like that you've given these questions and added this, like, encouraging the agencies to use more details, show us the data. It's still open-ended because the data is not always going to be the same for each agency, but it's clearly, to me, demonstrating to the agencies, the committee wants that tangible, evidence of your impact.
I also like that it involves, like, answering these questions, and I can remember these, helping the program directors with these. And you have to involve the case managers with these, and I really like the questions a lot. Like, they are going to be really involved, or not, but you can't even do this without getting their data and getting their notes. So I love the questions, the best practices questions especially. I was looking at it earlier.
High praise. Thank you.
Yay. Was there any more comments or reflections that you all wanted to add about the questions for case management and so forth? Is everyone comfortable with that? Any further discussion? As uncomfortable, or you have? Because if you're not. Okay, I'm checking, like the old school teacher, just checking.
So just to let the committee know, we're on a little bit of an aggressive timeline for our application. We would like to open the application in July and give the agencies as much time as we can to provide the information you are looking for. This dovetails into staff's request to cancel the July meeting and meet again in August, which we'll talk about in a minute. But before we can move forward, if the committee feels comfortable, we would appreciate a vote to approve the evaluation sheets and the questions. We can do that vote in two parts. So if the committee feels like maybe the evaluation sheets we want to revisit, weigh in questions or changes after some thought, we can vote twice. But to me, what's really important right now is the application questions, so we can open up that application. We had to do the evaluation sheets first so that we knew what questions to ask.
Okay, so if at all possible, if everyone is comfortable, I am going to request a motion regarding the application questions.
So moved for the adoption of and approval of these application questions for the application to open in July.
Second.
Thank you, Holmes Fry, and thank you, Alderman Harris. If we could have a yay vote, I'm sorry,
Voice?
a voice vote, yes, mine is still in a different hemisphere. Voice vote, as I lose my voice. All in favor?
Aye.
All opposed? The ayes have it, and the application questions for 2026 have passed. Application. If I can now have a vote on the evaluation process and sheet.
I
as it
move
stands?
to, because I didn't motion, we need a separate motion, right? A motion to approve the evaluation sheets for safety net and case management applications.
May I get a second? Thank you, Alderman Harris. With a voice vote, can we please have, I know, right? A voice vote, can we please have everyone's, all in favor?
Aye.
All opposed? The ayes have it, and it is so passed. Thank you guys for your hard work and putting up with me and my limited vocabulary this evening. Jeez.
All right, thank you. So our last item is the change to the schedule. And I'm happy to take any questions, but yep, staff is proposing we cancel July and instead hold a meeting in August. At the meeting in August, we will review ESG, get updates on the mental health provider program, and we will possibly have an overview of applications. By that, we will know how many applicants we're looking at and how much they are requesting. We will not, at that point, have detailed information about these evaluation sheets, but we can start.
Well, personally, my hope is that we will be able to get all of the information and give them, the agencies, enough time to submit their applications to us. Do we have any conversation over the date change? That would mean no July meeting, but there would be an August meeting,
And we need quorum.
and we would need a quorum. Oh, yes. Everybody has to come. Let's start checking those schedules, because I understand August 14th is, people getting ready to go back to school, go to college.
High school started already.
Yeah.
Oh, really?
early
Oh,
this year.
girl, I ain't got no high school kids. Mm-hmm.
Yeah, I have it on my calendar.
So if all possible, could I get a motion?
I
For the-
move that we accept the revised calendar and cancel the July 10th meeting and accept the August 14th meeting in its place.
Thank you, Alderman.
I
Harris.
second.
Thank you, Boswai. Can we have a vote, voice vote, please? All in favor?
Aye.
All opposed? The ayes have it, and it is so adopted for this calendar. As stated, no July meeting and an August meeting. With that, I believe that we have concluded most of our business. There was no one for public comment online, correct?
No one signed up for public comment?
Wonderful. There's one person that was here for a public comment in person. You have to
Oh, I'm
come to this
sorry.
mic, boo.
Yes, please.
I just had a question. They were just talking about that rubric, which I thought was quite interesting. Because you were talking about keeping it at 10 points, 5 points, and then 0 points. And if you were to increase it, I mean, most evaluations have a rubric. So you have a rubric so that people can know this is what I need to get for 10 points, this is what I need for 20. So I don't know how funding goes. I just thought, oh, if you increase it to 20, then those would be the people who would be, eligible to renew back to back. Those are the people who could be eligible for an extra 500 or 1,000, because that would be one of the only justifications. But then, of course, the rubric would have to be adjusted to verify or to determine, okay, this is a 10-point or a 20-point. It was just a talk out loud, that's all. And when you looked over, I thought you were talking to me, and I was like, this is an audience participation. And you let me know that, Chairperson Hayes. I'm Lori Martin. Yes. Thank you so much for letting me speak. Yeah, all right.
Thank you, Lori. And thank you for spending your evening with us.
But I get to meet like committee people, chair people. This is nice.
I just wanted to make a brief reflection about what's going on in our country, in our region, talking about the immigrant community, especially Latino immigrant community. And I think that somehow it's going to impact the segment of beneficiaries of these agencies somehow. We're talking about fear to go out, fear to get services from agencies, institutions, and that will be reflected. I believe that it will be reflected, and I just wanted to make this reflection and for all of us to consider. That's all. Thank you.
Yeah, it's already started, so you're right. Yeah, it's already started. We'll have people on waiting lists that took themselves off. Yeah. Yeah, it's already started. Oh, gosh, yeah. Because they're scared. Yeah, me too.
Right. Any other announcements or for the community at this point? No? All right.
Real quick, Moran Center is having a free legal clinic on the 26th. It's for free, 25 minutes from 6 to 5:30, and there will be 4 interpreters, volunteers, in English, Spanish. So this is something really nice to share. This is Moran Center, and it will take place in the main library, Evanston, in Arlington. The 26th is a Thursday, I guess. Yeah, from 5 to 6:30. There's no need of there's no appointment needed. Okay, thank you.
Beautiful, beautiful.
Can we include that in the minutes, that way it, thank you for sharing.
And with that, I believe that we are officially adjourned. We have met all our business for this evening. And I will see you guys, I don't know, in August, in a couple of months. Okay.